Hello and welcome. When I recorded this audio, this little tiny talk, I had the most dreadful cold. I've still got a little bit of the residue of it now, so my apologies for the quality of my voice. I'm really quite croaky in places, but I wanted to record something that just spoke about the nature of, and indeed the need for, emotional resilience in relation to suicide or suicidal thoughts. And so I recorded it anyway. It was very much in the moment, and I hope it will be of value along with any of the other talks that I am putting up into my library as a free public resource. When we talk about mental health, we're not just talking about issues of the mind, we're talking about the way that we feel. And a really good example of this would be, an extreme example, but a very good one, would be suicide. In the 26 plus years that I've been listening to people as a therapist, I've worked with an awful lot of people who have at some point attempted suicide or been suicidal. I mean, we could say that's the extreme end of a mental health crisis. All of those people, the one common denominator that they had, regardless of circumstances or regardless of, life issues or indeed mental health issues, was that they simply could not bear to feel the way that they were feeling anymore. They'd had enough. They couldn't cope. But it wasn't that they couldn't cope with what was going on in their mind. It was that they couldn't cope with the way that they were feeling. They could not cope with their emotions. So emotional health underpins our resilience in terms of our capacity to deal with any mental health issues that we may be challenged with. I will say much more about this subject in some of the other talks and audios in my library, and we will be focusing on suicide later on in the year when it is International Suicide Prevention Day. So you will be hearing more from me about that. Thank you and take care.